Okay, so this morning's second panel will be focusing on the influence of nursing on social justice and offering a look at historical, social, and legislative impacts. And again, a reminder that you can submit your questions either through our conference app or in writing. And if you go ahead and write it and then let our scholars know, they'll pick it up and bring it up to the panel. So it's my pleasure to introduce our Conference Planning Committee member, Peggy Wilmoth, who will introduce the panel members. Peggy.
Good morning, everyone. I hope you're enjoying the conversations as much as I have. And I think this next panel is going to do a great job extending the conversations that we're having around social justice. So it's my distinct honor to introduce our panel members, and they'll join us on stage one at a time. Our first panel member is Dr. Julie Fairman. She is a well-known nurse historian from the University of Pennsylvania, who's very well known to the Academy, and she'll be addressing the topic from the historical perspective. Dr. Mary Sue Hyman is from UCLA, and she has a program of research on the media as it intersects with culture that has created a new model for nursing science of transmedia. And our third panelist is the Honorable Shirley Nathan Pulliam, Senator in the Maryland General Assembly. She is a nurse with a long history of addressing social justice in both her nursing and her legislative careers. And our moderator for the panel is Dr. Diana Mason, past president of the Academy. And you can find their full bios in the program. And Dr. Mason is going to start the conversation and lead us into some continued good discussion and dialogue. So thank you very much to our panelists, and thank you, Dr. Mason.
Thank you. Okay. I think over there is yours. Good morning. For this last panel, I think I would like to start with asking, what is social justice? In a 2006 article in Health Affairs, Larry Gostin, professor of law at Georgetown University, and Madison Powers, a professor of philosophy and ethics, point out that justice is about two things: the fair disbursement of common advantages and the sharing of common burdens. Within a health context, they point out that it's about promoting the health of the population and fair treatment of the disadvantaged. Now, yesterday, in what I thought was a marvelous opening session with Ralph Smith, he discussed the moral imperative to act when action will make a difference. The moral imperative to act when action will make a difference. And we're going to be talking this morning about how to act and when to act. Gostin and Powers point out that a social justice framework won't tell you, do this policy, but it does call for policies of action that are consistent with the preservation of human dignity and the showing of equal respect for the interests of all members of the community. So we're going to be looking at this concept from historic perspectives, from a current contemporary environment of social media perspective, and from a legislative perspective. And Julie Fairman will lead this off.
All right, if I could have the first slide, please. Oh, not that one. So I'd like to thank the Academy for the honor of speaking to you all here on this really critical topic of nurses' engagement in social justice. Shirley Chisholm, who was the first African-American woman elected to Congress and in 1972 the first African-American candidate for president, said, "Service is the rent we pay for the privilege of living on this earth." She placed service in the context of the contribution to the common good and serving others, connecting service and social justice. Now, the relationship between nursing, service, and social justice is complex and multidirectional. It's part of our code of ethics, as nursing's work with patients should be inclusive and rights-based. But as we will see, social justice is context and lens dependent. Some nurses participated in death and destruction and marginalized populations in the protection of tradition and the rights of particular populations, while others looked at broader missions of inclusion. We claim nurses work for social justice, and social justice is part of nursing. And for the most part, it is. But our claims are somewhat complicated, as I will explain. Now, social justice spans the spectrum from liberal to conservative ideologies. Take, for example, the Women's March in Washington, and a week later, the Right to Life March in Washington. Both had common elements of women and protest against inequities. And nurses participated in both of them and believe their efforts will improve conditions for particular segments of the population. This is a great example of how complicated social and lens-dependent social justice can be. Perhaps one of the most well-known examples of nurses working for social justice is Lillian Wald. I think we all know a little bit about Lillian Wald, but we probably didn't know that the Settlement House in New York City in Henry Street provided all kinds of services. It provided classes based on childbearing classes, budgeting, hygiene. They hired lawyers to help tenants work with bad landlords. She helped establish the United States Children's Bureau and worked for years to end child labor laws. She advocated for the mentally ill, and she also lobbied for years as a campaigner for civil rights, and all of her classes at Henry Street were integrated. She was the part of the group in 1909 that helped establish the NAACP. With her friend Mary Brewster, Lillian Wald also established public health nursing to keep people healthy in their communities. But even so, public health nurses were also known to be defenders of nationalist movements, reporting un-American habits, which led to the immigrants' loss of their children to institutions which Americanized them, as well as the removal of children from Native American reservations to schools in the East. It's a very complicated picture. Now, nurses' involvement in civil rights is another very complex example. Nurses work to integrate and keep and maintain segregation in nursing education and in hospitals. Nursing organizations have a very mixed history in terms of participation in civil rights. While ANA leaders did challenge social and racialized stereotypes of nursing, local members of state nursing organizations in the South and more subtly in the North were denying membership to African American nurses even as they served their country in World War II. And the ANA did not actively intervene to force integration, much to the disappointment of Mabel Staupers, an active ANA leader pictured here. Integration of nursing reflected social justice across many levels, but was more than a racially based movement for equality. It also reflected class and gender issues. Both African American and white nurses saw professionalization as a way to raise the status of all nurses, except for those who were men, as well as protection of their income. Lay nurses cared for victims of violence and protest, as did the Sisters of Mercy in 1965. They provided life-saving care to protesters, for example, Representative John Lewis, and other protesters who were attacked during their March for Voting Rights as they crossed the Edmund Pettus Bridge in Alabama on Bloody Sunday. That day, Sister Barbara Lum was on duty at Good Samaritan Hospital. It was the only hospital within 9 counties that would accept African Americans. And the sisters cared for the protesters even as their bishop warned them against civil rights activities. The women's health movement is another example of nurses' complicated engagement in civil rights. Let me just go back here a second. I can't, can I? Let's see. There we go. Oh, never mind. Can we go back to slide number 3, please? So the women's health movement in the 1970s is really also very complicated. The Boston Women's Health Collective, let's see if I can bring that up now. No. There we go. Thank you. As another example, it developed a publication, Our Bodies, Our Cells, that shaped the health of millions of women. And nurses were part of this, though they identified primarily as women rather than as nurses. But nurse practitioners, for example, were a critical part of this movement. And many women in the women's health movement went on to be nurses. There's no clear count, but they saw their experience with nursing as one way to engage in social justice and to humanize women's health experiences. On the other hand, nurses were sometimes seen as part of the patronizing medical system, and many times they were, aligning themselves with medical doctors and the status of science rather than patients. Nurses also participated in medical research that did not respect the rights of patients. And I would argue that nurses have not led in the protection of LGBT rights for that population. Nurses have also been involved in social justice issues that aimed at addressing class, political, and racial issues, but in a very different way than, for example, than the civil rights movement. For example, eugenics was the dominant social and scientific paradigm in nursing and in science until the 1970s, and nurses supported it. They went to fairs and they picked out babies that they saw as specifically normal. These were better baby fairs. Nurses also participated as individuals in the forced sterilization policies of several states, and not only in the South. They identified patients for sterilization and then helped them get to the ORs for their procedures. These were class, gender, and race-based issues that many nurses saw as a way forward to improve their communities from a very particular social justice perspective. Hagemar, pictured here, is a World War II German euthanasia hospital for mentally and physically children and adults. While the staff pictured here worked to meet the mission of cleansing the country of certain types of individuals they believed for the good of the country, individual nurses resisted by hiding patients or fabricating records. Now, José Saramago, who is the Portuguese Nobel laureate, said, "The circumstances create the need, and the need, when it is great enough, create the circumstances." Historically, nurses have gone where they are needed, which in itself is part of social justice. When you think about the nursing profession, its dedication to serve the public in many different ways from many different perspectives, you can see the historic complexity of nurses' work towards social justice and the complexity of our claims. The value of history is that it should help us seek newfound perspectives from this particularly complex story. In a recent New York Times article about the Burns-Novick saga of the Vietnam War, historian Gregory Daddis writes that the history should stimulate new conversations, and I am proposing the same. In this case, conversations about nurses' engagement in social justice. These conversations should help us listen to and learn from the multitude of voices across time and place, and perhaps more important, to the voices of those with whom we reflexively disagree. History helps us fathom how competing motives drive humans to make difficult decisions, both good and bad, and helps us put into place resources and the transparency for better actions. Nursing through organizations, or as nurse Lashia Evans shows us here from Baton Rouge as she protested the Alton Sterling shooting, as individuals, serve their community as best they can, where they believe they are needed. Service is the rent we pay, as nurses, as members of communities, and as citizens. And our service comes from our historical perspective with patients and our involvement in social justice issues across time and place. Thank you.
Thank you, Julie. Thank
Will you hand me that?
you. Mary Sue.
Thank you. Following after that, the focus of this talk, this part of the panel, is going to be on social media. And I'm going to take us through a discussion to get to the place where we can begin a discussion about how we can use social media to do the crucial social justice work that needs to be done. there are many examples, there are already many existing examples of nurses engaging in advocacy campaigns that are related to social justice on the internet, including Edgerunners, such as Linda Sarna and Stella Bielos. With tobacco the leading cause of preventable death in the world, affecting people and reducing health equity, Linda Sarna and Stella Bielos have created a program that's available online with a worldwide reach because of the internet, with tips and tools and other online resources. Social media involves internet-based websites and apps that allow users to view, engage, make, or share content. This leads to the creation of social networks. An individual example is also Nurse Mendoza. I found Nurse Mendoza online. His name is Edgar Mendoza, RN, and he's engaging in social media for the good of others, in this case for the empowerment of nurses, specifically men and nurses of color. He's on Facebook, Instagram, YouTube, and you can see here he has 163,000 followers on Instagram. On YouTube, he has an impressive array of self-produced videos, and we're going to go much more deeply into that. But first, I want to provide some context. Social media is relatively new for human beings. It's a new phenomena. So let's get some context, and then we'll go back at it to look at what nursing is doing and what nursing can do in the future. So in order to do this, I'm very excited, I must start with, being here at this venue, and I want to thank Linda Scott and the Planning Committee for inviting me, because as I look out, I see all the movers and shakers of nursing, and each one of you is a leader, as Bobby said earlier. Each one of you has a sphere of influence and a network of colleagues and students and co-investigators. Nurses and the public are looking to you for perspective on what's going on and where do we need to go in the future. So I hope to catalyze some thinking today and help us think and strategize about the future, looking at a trajectory running 10, 20, 30 years into the future related to social justice and social media. But in order to look forward, it's worth it to take a moment and look back, and to do that I want to use a story that comes from physicist Neil deGrasse Tyson. He once created a museum exhibit that chronologically laid out the history of the universe, 13 billion years, in a timeline that was so long that it filled the length of a football field. Oops, there we go. It filled the length of a football field from the Big Bang to today. And when people went through the exhibit, they got to the end of the exhibit and they were confused because they saw nothing about human beings or human civilization. And they were all this way, but nothing about humans. Well, it turns out, and now I'm going to go back if I can, that the entire content of human history in the universe is equivalent in this timeline to the thickness of a single strand of human hair. So Dr. Tyson actually installed one human hair at the end of the time exhibit so that it made sense to visitors. So today I want to focus as far forward on the edge of that strand of hair. I want to shrink down and focus on just the outermost edge, the most recent years in time, just the last 90 years in human history, and I specifically want to zero in on what humans have done with media technology. It was just about 90 years ago, that in 1927, the electronic television was created, and it was made available to people. By 1947, a few thousand Americans had a TV in their home, but by the 1990s, 98% of all American homes had at least one television set. In 1963, Kodak introduced the low-cost Instamatic camera. With its point-and-shoot approach and its easy load capacity, anyone could be a photographer. In 1981, the first mobile telephone was created, the Motorola Dynatac 8000X. But it wasn't ready for market till 1983. It was 13 inches high, and it cost nearly $4,000. In 1981, the first portable mobile computer was available. That was the Osborne 1. Now, fast forward to 2007, when a monumental thing happened. That was when the first iPhone went on the market, and it was soon followed by Androids. And this put computers, well, it put small telephones with computer capabilities and a quality level camera into our hands and into our pockets. So one could say that we are rocketing ahead at an amazing speed in media and communications technology, but we need to be careful not to be like Wile E. the Coyote. We need to be innovative, yes, but also collaborative, as Mary Wakefield said yesterday. Wiley was innovative, but he didn't collaborate very well. So within the last 10 years or so, we got smartphones en masse. And we humans took to smartphones with gusto. In fact, a 2016 study found that people tap, touch, swipe, or click their smartphones an average of 2,617 times a day. Clearly, we humans love to use our smartphones. And why not? When connected to the internet, we find ourselves equipped with a wide array of tools that were practically unimaginable to most of us just a few years ago. For example, Facebook. It began in 2004, and it's now the most used social media platform in the Western world. Collectively, we send 30 million messages per minute on Facebook. And the end is not in sight because Mr. Zuckerberg keeps finding new ways to attract our attention by adding features like Facebook Live. Another tool is YouTube. It started in 2005 with the first YouTube video being posted, but fast forward to today, and now YouTube has 30 million visitors a day. With YouTube, anyone can make a video, post it, and it can go viral and be seen by millions of viewers. But research shows us that clicks and likes don't actually matter. If you want your social media to make a difference, it's engagement that we need to have, because engagement leads to behavior change. In 2006, Twitter was created to be a cheaper way for people to text each other, but today we collectively send 350,000 tweets per minute. With Twitter, it's different though because there's engagement, and it's happening in real time. Like Facebook and also like reality TV, the experience is right here, right now. It's immediate. It's a kind of communication media that feels more real and more compelling than it ever did before. These social media tools are just 12 to 13 years old. It's so very recent. But remember that advice from Mary Wakefield. We need to be innovative and collaborative if we want to ignite change and affect health policy. In my case, I wanted to use transmedia, which meant I was going to have to partner with Hollywood. I wanted to use media, specifically in social media, with storytelling to create health interventions. I had a lot to learn, so I sought out every opportunity to learn about social media, film, television, and the use of storytelling accessible on a smartphone that I could. Collaboration was absolutely required. About 3 years ago, I came upon Social Media Week, which occurs in multiple cities around the world at various times each year. This week-long event is truly amazing. There's about 15 speakers every day and lots of different events. Most of them are creators, consultants, innovators, and there's a focus on market forces as well. I've attended a few times, and I just keep going back because it's opened my eyes about the possibilities of social media and what human beings are doing with social media. However, every time I've gone and I kind of mingle around and talk to people, I have never met a single registered nurse or physician or any healthcare member at a Social Media Week event. The other reason that social media is where I think we need to be as social justice advocates is because many US adults get their news from social media. 44% get their news from Facebook. So it's not just about entertainment. It's about so much more. But to create meaningful change and to ultimately influence policy, if we want to create interventions, if we want to create new innovations, we need to collaborate. There are multiple organizations that are using social media campaigns very effectively in very out-of-the-box ways. They too are focused on social justice and health. If we, as nurses, teamed up with them in creative collaborations, what might the future hold? Thank you.
Thank you. And let me point out, Mary Sue is to join us as a new fellow tomorrow night, and we need you. Thank you. Senator.
Yes. Good morning.
Good morning.
I bring you greetings on behalf of the Maryland General Assembly, and most specifically, the Senate of Maryland. I'm serving my 23rd year in the 20 years in the House of Representatives, and I'm in my 3rd year in the Senate. And it is indeed a pleasure to be here with you. I want to say a special thank you to Dean Kersling, the Dean of the School of University of Maryland School of Nursing, for inviting me, my alma mater. And so this morning, I don't have a slide, and because I was told to just speak to you. So this is exactly what I'm going to do.
That's right.
As you know, that the American Academy of Nurses' vision is transforming health, policy, and practice through nursing knowledge and leadership. That is why we're here, through nursing knowledge and leadership. And so serving in the legislature is a different type of leadership, but, and which I hope that we had more nurses in the legislature. At the present time, there are 3 of us, 2 in the Senate and 1 in the House. When I was first elected, we had 4, 2 in the House and 3 in the House and 1 in the Senate. So we really have to do better. That's over 23 years. So we have to make sure that people are elected to all different levels, from the local government to, and there's no nurses in the local government. So we really have to do a better job. So let me tell you a little bit about my story and what propelled me to run. For many years, Alicia George and all the others sitting there know that I have been involved since I was in my 20s, walking the halls of Congress, looking at dealing with racial and ethnic disparities and serving. We served under Congressman Louis Stokes, learning all we could about racial and ethnic disparities and how to close the gap. Fortunate for me, after elected, I served on they created my own committee on racial and ethnic disparities, only because they got tired of me putting in bills after bills, talking about morbidity and mortality rate. Many times I was invisible, but when they realized that invisibility didn't stop me, they finally created my own committee. So, but what really propelled me was that this is Breast Cancer Month. October is Breast Cancer Month. And so the story came right back to my mind, never have left it all these years. That one day, I was charge nurse in a unit, and we were very short-staffed, as many of you know how that goes. So this time, I'm going in to provide bedside nursing care. So as I went in to bathe the patient, she was in a bus accident, a school bus accident, and had a compound fracture. As I went to wash under her axilla, as I went to wash, I felt her breast. It was hard as a stone. I looked at her and I said, "How long has your breast been like this?" And she said, "Oh, for quite some time." I said, "I'm sure it's quite some time." I said, "Why didn't you seek help and go to the doctor?" She said, "I had no job and no insurance. And I was waiting to find a job with insurance so that I could go to the doctor." I told her then that the compound fracture was not the big problem here. The problem was her breast. She said, "Please don't tell the doctor." I said, "Oh, yes." I was a little bit annoyed that she came to the emergency room and nobody picked it up. But anyhow, I watched that lady through chemo, radiation, through both mastectomy, and eventually to the day she died. That stayed with me for all these many years. So it propelled me, and I started saying, there ought to be a law. There needs to be a reason that everyone should have health care in a country as powerful as the United States of America. So with that, I began with all that I learned under Shirley Chisholm. It was beautiful to see you had Shirley Chisholm learning a lot at her feet. And all of us through the Black Nurses Association and all the different groups that I was working with. In learning it, I decided I'm going to run. I'm going to run for political office. Somebody got to make a difference. And so my theme, the nurse for your political health. And when I say the nurse for your political health, it doesn't just mean just health. Because if you have to be emotionally healthy to become, and physically healthy, to become economically healthy, and I can go on and on. So with that, that was my theme. And I'll tell you the story. I was so upset about what was happening. So that was an example of a real social justice issue that needed to be addressed. When I was elected, in the second year after I was elected, I put forward a piece of legislation that I received $2.6 million for diagnosis and treatment of low-income women for breast cancer. And in doing that, I had a big fight, even to get it at 250% of federal poverty. That was a big fight between my chairman. I don't have time to tell you the story. But anyhow, we fought about it because he wanted to make it lower. And I said no. I went on the radio. I went on, that was at that time. Went on the radio. If I wish I had Facebook, then I would have put it on Facebook. But I got to every women's group to call in. Nothing happened until one morning I saw him with his head down. And I said, "What's wrong, Ron?" And his wife had a breast lump. And he was worried. So he went, I hugged him, and I told him 80% of them are benign. Don't worry about it. Just go and be there with her to hold her hand. And so 3 days after, he was back in his seat, and I looked out at him and I say, "Hey, how did things go?" He said, "Oh, Shirley, thank God. It's not cancerous." I said, "Well, wonderful." Didn't ask about my bill. I got back to my committee, and he came up to me and said, "Shirley, do you have the votes to get your bill out?" I said, "I've had the votes all along." So this is how I got my $2.6 million to start that.
Wow.
And later on, I'd want to share with you later on, many years later, it's another story that I don't have time to tell into detail, but a woman who was diabetic, she went to the hospital. She was getting a mastectomy. They told her nothing by mouth, but nobody explained to her not to take the insulin. So she took the insulin because it was nothing by mouth. And so when she got in there, she went into hypoglycemic shock. So they could not do the surgery. I had to bring her back and get her stabilized. So they did the surgery, and within 2 hours after the surgery was done, she was in a wheelchair to go home. She was not even fully awake when the family called me, hysterical. What do we do? I told them, take her to the emergency room. With that issue, I don't have time to tell because she's going to shut me up in a minute. But what I did was, I was in an old pair of jeans washing my car. I jumped in my car and went straight to the hospital, wheeled the lady back, insisted that they take her back. They thought I was nurse on staff because I had her back in bed, on the bedpan. Did make sure I'm asking, please, this woman needs some morphine. She needs this and need that. I'm telling them all this stuff. And they were following my orders. They thought I was a part of the emergency room staff. But anyhow, that is how I put in the next bill. And the next bill that says that at a minimum of 48 hours, if the person does not want to go home, if they don't have any support system at home, a part of a woman's body who defines who she is, she should not be just cut off and put out without any emotional support. And so with that, I got the other bill passed the General Assembly. So you can, so as I come to close in my comments, I wanted to say the American Nurses Association Code of Ethics confirmed that for all of us, the dedication of nursing quality and healthier communities come in the form of advocacy. We have to advocate. You can't send anybody to hospital now without you able to advocate for them. It's sad, but it's true. My son just had surgery, and I had to be there advocating for every aspect of it. So But we know that there are over 3 million of us nurses in the United States. And at the same time, we have 3 times as much doctors, but we don't have the same power to get things done. And I know I look out in this room and I see, as I'm borrowing something from Mary Sue, when she said that movers and shakers are in this room. Yes, we're at the top of the professions that are here. And I hope that I'm not going to embarrass you into what I normally do. I normally, when I speak before nurses, before I finish, I ask them, put your hands up if you know who your local, state, and federal legislators are.
Ask them.
Oh, well, that's good. That's wonderful. That's the best I've ever seen, because you're at a different level. I would say, I'm used to 2 hands going up, okay? So what I'm saying to you is that since so many of you are active and know who your elected officials are, we need to get that down to the younger nurses that are coming up. They have no clue, none whatsoever. Some of them don't even know what a delegate or a representative or a senator is. So we need to make sure we bring them. And this next year is a great year. It's an election year. Congress will be having an election. The state will be having an election. They need to find somebody and get that word out to them. Find someone that they can work with their goals and objectives that are similar to yours. This is how I started. I worked on everybody's campaign as long as their goals and objectives were similar to mine. And so that's how you really get involved. And when you need a scholarship, when something's going wrong in your community, and those nurses who work with me call me, hey, I take that call. Don't care how busy I am, I take that call. And they need a scholarship, I'm going to say to my person, my scholarship committee, look out for so-and-so when you're looking at the scholarship. But the fact is that if you don't get involved, they don't know you. Because of the number of calls that come in and emails, I've probably got 19,000 emails on there that I haven't answered yet. It's just too many emails. They're coming in from every direction. The reality is that we have to work hard and getting the word out to the younger nurses to get them involved so that they can run for office, so that they can work, number one, to campaigning with people, knocking on doors, licking envelopes if that's what they have to do, so that they're known. And then write letters to their elected official. And if they do it, don't write 3 pages, just 1 page, some bullet point, to the point. This is what, because they have so many people calling and so many people that they can't answer them all. But if you get to the point and say, I'm a nurse, and this is the issue, because guess what? I serve in a committee, I'm the only nurse. I'm the only healthcare person on that committee, on education, health, and environment, and everything else, election laws, you name it. But I'm the only nurse. When I was in the House, there were 2 of us, not 2 nurses, but 1 person was a psychologist, and one medical doctor that was in the House. In the Senate, that's not so. But we make the laws on healthcare issues. So we need to make sure that we then, in fact, educate our folks on how to communicate with their elected officials. So I think that's about what I wanted to say. I cannot stress enough how it is to get important. Oh, at the state level too, I want to say that. We spend so much time, when I look at M&A, or AAN, more specifically American Nursing Association, yes, everything is on the federal level. When I see things in the Maryland Nurses Journal of nurses at a different level getting involved, and I'm excited about it. But the sad part about it is that the federal take forever to get anything done. But we in the state legislature are closer to the people, and we can get those bills passed faster. So with that, I thank you.
Thank you. So, Senator, have you considered running for president? And do send your questions in, but let me lead off with, so we're in a very polarized political environment, and Lyndon Burns Bolton in the prior session talked about finding common ground. So here we're talking about social justice, but there are other core American values, many would argue, that are undergird what we believe, how we act, the policies that we develop. Values around individual responsibility, around free enterprise, and around health as a private matter, not a social justice matter. How do we find common ground in this polarized environment? I'm interested in historically, do we have examples of how common ground was found, Julie? I'm interested in, is social media creating more of a, is it a medium for finding common ground, or is it just ratcheting up the polarization? And Senator, I'm interested in how do we frame issues and bring people together in this polarized environment? I'm sure you've got experience with that, to find that common ground. Who would like to start? Julie?
Sure. So common ground is a really interesting political issue because not everybody sees the same thing when they think about healthcare for all. So there are examples when nurses have really come together through disasters, through at war, for example. But again, you know, the idea of seeing health, for example, healthcare for all as a common value looks very different from different perspectives. So I think, you know, we have a code of ethics in nursing. It's a great code of ethics. It includes the ideas of social justice and rights-based nursing. It's a document that can bring people together. But again, remember that this is all context and lens dependent. And we are a big organization and we have many different political views.
Yes.
So look to the code, I think.
Great. Thank you.
What I would add about social media, you know, social media is obviously the point of what my comments was that it's a very recent phenomenon. And it is a different world. I mean, the more we can recognize that it is a different way of communicating, and it's shifting power dynamics all the time. So people who otherwise would never get heard can get heard easily, depending on how they interact and who they connect with, because of course social media is all about social networks, and so people can connect, and then voices that were previously, you know, way back in the background can suddenly become very prominent. But Julie and I were talking about this a bit earlier, that despite the fact that different people are popular on social media, and they might be, you know, lots of clicks and likes and people retweeting and things like that, they aren't necessarily the source of knowledge. They're propagating ideas, but social media is a medium that is of the moment. It's very much amplifying what's happening at the moment. And so if it appeals to different groups, then, and they respond, then things will move in that direction. But it's very fluid. And I think if we get a stronger sense about that, we can start to conceptualize common ground in a new way. I think that's what it's going to require of us, is to think differently about that.
Interesting.
Yeah.
Senator.
Well, in terms of polarization, I guess I probably have to view it a little bit different, because I'm talking about how do I get legislation and things passed when I have the Democrats here and I have the Republicans here, and I'm in a committee, okay? I found that I find just one or two that I can really get along with, that I can really bring over and get involved on certain legislation so they can be co-sponsor of the bill. Because, you know, in the legislature, we say, this is that's a bad sponsor, meaning that, you know, that bill ain't gonna pass, because it's about relationship, how you build relationship, both with the Democrats and the Republicans. So when I have a bill, I go around and I talk to all of them, and I try to get everybody to sign on. Most recently, my chief of staff, we just worked very hard on the Henrietta Lacks bill to create the Henrietta Lacks Way in the area that she did. For any of you who know about Henrietta Lacks. And so I was able to get my co-sponsor, I put two sponsors on the bill. The Republican senator who represented that area, I went and asked him, would you like to join me in sponsoring this legislation? It's in your district, but I'm gonna put it in anyhow, so you might as well come and join me. So he did. And so that's the way we've been excited about it. So more people are coming over and say, how can we do things together? So that's the one way of kind of bridging the gap. And I have many other bills. We just did one on health and all policy that I just got passed. And we were able to bring some of them in. And I think hepatitis C. And I could go on some of those bills that I was able to bring someone else from the other side over to support my legislation. So that's what you have to do. And in terms of social justice, social media, I was able, with my help of my young chief of staff here, who reminds me every time, this should be on Facebook, you should put this on there. So now we go Twitter, this is Evan, that here. We're on Twitter, we're on blog, we're on Facebook, we're on everything that he can think of. We're on, okay? And so, and even for the Breast Cancer Month, we're on there. If you go look us up, you'll see us talking about early detection and how important it is.
Good. So let me just drill down on that a minute. So one of the things that I think is really important in this conversation is the idea of framing. How do you frame an issue that, so Linda brought up in the last session the culture of health work, and the Robert Wood Johnson Foundation did an analysis of social determinants of health, that language, before they developed this initiative and called it Culture of Health. And they found that that language does not play well across the political spectrum. There are some who believe that if you talk social determinants of health, you're talking socialism. So they didn't use that language. And it's an example of framing and the importance of framing, that if you come to people with language that plays into a bias or a value that is repugnant to them, they won't play with you. So I'm interested in this issue of framing, and how do we frame social justice issues in ways that respect the values of free enterprise, individual responsibility, and health as a personal responsibility.
You're all looking at me. Maybe I
Anywhere.
defer to the senator this time.
Senator.
I'm happy to jump in.
Yes.
As a qualitative researcher and with a focus on social justice, I think we have to go to the groups we're targeting and talk to them and hear from them. And if you're targeting teens, you have to understand where they're coming from and what, and literally, I mean, part of it is we have to let go of the preconceived notions we have, or whatever boxes we are. Who said it? I think Stephanie Ferguson said it, that we're nurses that we're so used to solving problems left and right and go, and that causes us sometimes to make a judgment about something, put it in a box, and then get busy. But with social justice, social media, I think we have to throw that off and try to be as open-minded as possible and see what are 20-somethings, 30-somethings, 40-somethings, and people of different, characteristics. What matters to them? What are they talking about? What are concepts that they're using that make sense to them and cause something to be of value? So I think the framing, we're not going to come up with it. We're not going to come up with how to frame something. We don't have that knowledge. It has to come organically. It has to come from and that's what happens on social media. It's always some organic thing. I mean, look at even the Chewy mask, the woman who got that Chewbacca mask. If you haven't seen that video, you gotta see it. But it's just this organic thing, it just happened. But it was caught on film, and it caught on, but it caught on for a reason. It's compelling. And everybody's life is lived day by day, hour by hour. But everyday life is the stuff that gives context to what's meaningful to us. So as researchers, as nurses, as justice workers, we need to understand how people are understanding their world in order to then frame it in a way that comes from them.
Right. So let me go ahead.
I just wanted to quickly, I think Yolanda will kill me if she think they speak about social determinants of health and I haven't said anything. I started a task force on social determinants of health to address, and I know what you just indicated, but what we did was actually, Dr. Yolanda Agbalu, can you stand? She's also one of your new, fellows that's going to be inducted. Okay, Yolanda. Yolanda chairs my social determinants of health task force that was created, and what we did, we did a PowerPoint that was first and brought all the leaders of the all the different communities together. And we show it, and we went through step by step, and what about social determinants, what's make you sick in that particular, the district that I represent the county and the city. I have 75% of the county, 25% of the city. The 25% work me harder than the 75. However, so we decided to look at that 25. And so we created a task force a subcommittee on human services and health and human services, citizen unrest and social justice, education, workforce development and job creation, and housing. Okay, and so we have these little pockets working. I think right now we're trying to get some funding to light up the community so we can work on people who are afraid of the rate of coming out in their communities because of violence, because when we have high unemployment, high violence, where you have high everything, high diabetes rate, high blood pressure rate, because as I said, it's not the genetic code that gets you, the zip code. And so we have to really work on those issues, and we've been doing a pretty good job. Kind of slow. If anybody knows where we can get some additional funding to light up the city, just let us know. Thank you.
Thank you.
Yeah.
So a very quick question, and with the direction to me, Diana, do this question first, so you know. Anyway, it's a short question. In the past 10 months, I have signed more online petitions than I'd ever seen in my whole life. How effective are these?
They're
Do
petitions.
do you get online
Online
petitions?
petitions.
Do you get petitions, Senator?
They're effective.
Well, you mean to just sign on for different things?
Yes, a petition that citizens would sign, a whole list of citizens would sign.
I do get them. I don't sign them all. And I
But
think
when you have ones that are given to you by citizens saying they want you to do something.
Oh yes, just this past week. They're passing another petition around on the bill that the governor vetoed. So they've been calling me around and have to sign a petition to say I'm going to support the override of his veto.
Great.
So we've been working, but there's so many other groups that comes in that we have to fill out.
Mary Sue?
Well, just, you know, even you think of, this is more about the image of nursing, but, you know, Sandy Summers and the group that collected signatures about the MTV television show that was portraying nurses as partiers and a few other things. And it was very effective. Now she's putting forward a petition because of the Netflix show that's going to be featuring a young Nurse Ratched. Nurse Ratched is known as the sixth most notorious villain in television and film. And they're creating a television show to show a very, you know, sinister young Nurse Ratched, which is certainly not going to present an accurate portrayal of nursing. So I urge you to sign that petition if you haven't. But they have been very effective in swaying anything that has that many signatures on it. It sways opinion. I mean, I'm glad to hear it sways your opinion, but in Hollywood, it does have a cachet.
Mm-hmm. Well, I can't really speak to the petitions, but want to go back to the idea of framing. And I think one of the things that will unify us is the framing of our work around what we do for patients. Because I think even if you might see things differently, if you can look at the good of the public, we will be able to come together in a way that we haven't been able to before. You know, as I said, we're a large group of people. We're not all going to agree in terms of what this will look like and what we should be doing. In fact, there's many different political opinions out there. And so, you know, we find something we can rally around, and that is the good of the public. And from then we have conversations to build the framework.
So there are a couple questions that deal with very specific issues. One having to do with that in many states, only 22 states in the District of Columbia have laws that ban shackling of incarcerated women during labor and delivery. That's one example. The others, reauthorization of CHIP and some others. So this question from somebody else says, those of us living today will be the history studied tomorrow. What are the key lever issues that nurses need to engage in today to ensure a just and healthy future? Big question.
Mm-hmm. It's a beautiful question.
Beautiful question. I don't know where to start.
Well, you know, you can tell by all three of us told stories about the past. And so these are historical narratives, really. And stories are incredibly effective. In terms of even identifying the levers we need to think about to make a difference in the future. We all know, we've been, you know, if you think about, we've been working on this for decades, the idea of alleviating poverty, increasing access to health care for all of our citizens, a rights-based agenda. You know, you could go on and on. You can bring in the social determinants of health, the culture of health, something, again, we've been doing for decades. Right. But these are the levers we have to continue to pull, perhaps in very different ways because the context is different. But I think if we think about it and we use our stories, again, the powerful piece here is the stories to move that agenda forward.
I would agree, and I think the Edgerunners are an excellent investment. Creating the online presence, I use it, I've taught a class on ethics and social justice with freshmen in our nursing program, and having that access to the stories, the photographs, that's creating documents that will be carried forward. But it allows us, and I think this is maybe the lever, the issue that is of highest value to me, is that today we as nurses need to be in the conversation. We need to be acting, but not without recognition of the mistakes of the past, with an eye for the future, but we have to be open-minded. And as if we are open, and that's partially, you know, why I wanted to throw that out there about the human hair, the strand of hair. This is all happening very fast. And if we recognize that and take hold of that, how will that change the way that we act so that 10 years from now, we don't regret what we did, but we look back and say, wow, that was visionary. I'm glad that we got that perspective because we pulled together people and we thought that through and we strategized. And we didn't just, you know, throw a bunch of things together, you know, tactics, but we actually had strategy and we thought it through so that it had a trajectory.
And I guess I'm a proponent of think globally, act locally.
Yeah.
And I would challenge everybody in this room to think about what are you doing to promote a healthy community in your environment. And that doesn't mean building a hospital. It means truly promoting a healthy community through the social determinants of health and addressing those social determinants of health. Senator?
Probably we're in a climate where we're struggling with healthcare reform. Okay, we know what's happening in terms of the Affordable Care Act. We know there's a movement to completely destroy it and move it. I think if all of us came together, young nurses and us, the old nurses, all come together and send a message, a united message, that would be something to propel into the future. Because healthcare is a right and not a privilege. We've all said that over and over again. Yet still, I'm an immigrant. I came from Jamaica as a young woman, and when I got here, you know, I looked around, oh, America, the land of opportunity. And I lived in England, where I got healthcare, where I had everything that I needed when I was sick. And I don't believe all the propaganda you hear. I didn't have to wait that long to get any procedure. I still have family there that I'm in touch with even this morning. The reality is that we have to come together to make sure that every American has health care. It is a responsibility. If we could get that as nurses, we would have made a tremendous difference and an impact on this nation.
Yeah.
So we're about out of time, and just in closing, I'd like to share some thoughts from Martin Luther King Jr. from his letter from a Birmingham jail in 1963. He said, "Injustice anywhere is a threat to justice everywhere. We are caught in an inescapable network of mutuality, tied in a single garment of destiny. Whatever affects one directly affects all indirectly." So I would argue that social justice is not just a nice idea. It is a crucial part of our responsibility to promote health, and as such, a part of our social responsibility as professional nurses. I want to thank Senator Shirley Nathan Pulliam, Mary Sue Heilman, and Julie Fairman for joining us on this panel today and having this discussion.
Can I say one quick thing?
Last word.
I just want to say one last thing of Martin Luther King. Our lives begin and end the day we become silent about things that matter.
Yes.
We cannot be silent about them.
Thank you.